So we did receive confirmation of our first case of measles in Austin since 1999. It appears that this individual contracted measles while traveling in Europe in early December, and they returned to Austin, developed symptoms on December the 14th, and then developed a rash on December the 17th. The same day, this individual traveled on a United Airlines flight 790 from Austin to Chicago and then on to Virginia. The individual was in Austin for a period of about 3 to 4 days where they would have been able to expose other people. The locations we shared are not contaminated, but individuals who are at those same locations during those same periods of time have potentially been exposed to measles. And particularly for those people who are unvaccinated, they should be concerned about that association and contact their healthcare provider. Those areas that we listed where this individual traveled are completely safe today. They were a potential concern during the period of time that this individual was there, as well as up to 2 hours after. But after that, there is no risk. The most important thing for people to do who have not been exposed is to be vaccinated with the MMR vaccine. For those who have been exposed, it's important to contact their healthcare provider if they're unvaccinated to get advice from their physician. If they have been vaccinated and they develop a fever within 21 days from their exposure, it's critical that they call their physician prior to making an appointment to see them. Measles has a series of classic symptoms. That's cough, that's runny nose, and that's a rash with fever. That rash starts on the face and then spreads downward. It's challenging these days because it's flu season, number one, and many of the symptoms that happen in the 3 to 4 days before the rash happens are the same as flu. So we've sent out advice to physicians to ensure that they're aware of the particular things regarding measles that they need to be looking for. The other challenge is that we have a whole series of physicians who've never seen a case of measles since our last case was 20 years ago. So we're doing some re-education for our doctors to make sure they're aware. We have set up communications with 311, and we do have our Austin Public Health personnel who are manning phone lines to answer questions of that nature.
Are you guys expecting any other people who could be infected?
Well, given the attack rate of measles, which is 90%, meaning 9 out of 10 patients who are exposed who are unvaccinated will get it, there is substantial risk that we'll see other cases.